Okay, we'll talk briefly about some pediatric mental health. This is chapter 44. It starts on page 293 of your ATI book. It does talk a little bit about depression and post-traumatic stress disorder. It has just a little bit for you to read on page 293. I'll let you be responsible for that reading in your ATI book. First, we're going to talk about attention deficit hyperactivity disorder, or as many of you know it as ADHD. It's on page 294 of your ATI book. The definition is the difficulty with inattentiveness, impulsiveness, and hyperactivity revealed prior to the age of 7. So that's key, that it's prior, the onset is prior to the age of 7. Diagnosis is made, the criteria is the manifestations are present between the ages of 4 and 18. They're present in more than one setting. There's evidence of social or academic impairment, and the child has 6 or more findings from the categories that are listed on page 294. Those categories are inattention, hyperactivity, and impulsivity. So some examples of inattention findings would be failure to pay close attention to detail. They make careless mistakes. They block incoming stimuli. They have difficulty sustaining attention. They don't seem to listen. Failure to follow through with instructions. Difficulty organizing activities. Avoiding or disliking activities that require mental effort for a period of time, such as reading. Losing things, they get easily distracted and they forget. Hyperactivity category findings include fidgety, failing to remain seated, inappropriate running, difficulty engaging in quiet play, seeming to be busy all the time, or talking excessively. Impulsivity is blurting out responses before questions are asked, difficulty waiting their turn, they interrupt often, they may strike out, bite, or shout. So they have to have 6 or more findings from those expected finding categories. Risk factors include family history, exposure to toxins or certain medications, chronic otitis media, meningitis, or head trauma. Nursing care, so obtain medical, developmental, and behavioral history, use behavioral checklist, use a calm, firm, respectful approach, use modeling to demonstrate the expected behavior, provide short, clear explanations, obtain the child's attention before giving directions, set clear limits on unacceptable behaviors, and you must be consistent. Plan physical activities so the child can use their energy. Focus on the child and family's strengths, not their problems. Provide positive feedback when the expectations are met. Assist the child in developing effective coping mechanisms. Assist the family with behavioral strategies, so positive reinforcement, rewards for good behavior, age-appropriate consequences. Assist the family with modification of the environment to help the child become successful. So help them create a structured environment, decrease the stimuli, have a consistent study area, model positive behaviors, use steps when assigning chores. Pastel colors are actually recommended in the environment too. It seems to calm. Assist with appropriate classroom placement in school, so collaborate with the school nurse. Allow more time for testing. Place in a classroom that has order and consistent rules. Offer verbal instruction combined with visual cues. Plan academic subjects in the morning. Include regular breaks and provide for small classroom settings or work groups. Common medications, so Ritalin. It is a psychostimulant that increases dopamine and norepinephrine. Dopamine aids in the coordination and movement control and aids in regulation of the flow of information to different areas of the brain. Norepinephrine increases O2 to the brain to aid in clearer and faster thinking. Instructions for the client with Ritalin: gradually increase their dose. They need to give 30 minutes prior to meals and give the last dose of the day prior to 1800, so 6 p.m. Monitor for adverse effects, so insomnia, anorexia, nervousness, hyper or hypotension, tachycardia, and anemia. They should avoid caffeine. They must store properly because the Ritalin is easily abused. It's a sought-after drug for people that aren't prescribed it. They may also prescribe tricyclic antidepressants, and it's important to know with that, such as Strattera, that to monitor for adverse effects such as suicidal ideations. The next one we're going to talk about is autism spectrum disorder. So this is on page 295 of your ATI book. It's a complex neurodevelopmental disorder that affects the ability to communicate and interact with others in a social setting. Risk factors include genetics, but the exact cause is unknown. Signs and symptoms: delay in one or more of the following: social interaction, communication, and imaginative play prior to the age of 3. It's important to note that changes in routines are stressful for children with autism. They tend to have an unusual attachment to objects, the inability to start or maintain a conversation. They tend to use gestures instead of words. They may have delayed or absent language development. They may grunt or hum. They may have the inability to adjust a gaze to look at something. They don't refer to themselves correctly. They may appear withdrawn. They may lack empathy. They may have a decreased pain sensation. They may enjoy spending time alone rather than playing with others. They avoid eye contact. They may withdraw from physical contact. They may have heightened or lowered senses. They tend to show minimal pretend play and a short attention spans. They may have intense temper tantrums. They may show aggression, exhibit repetitive movements, and according to ATI, typically their IQ is less than 70. So you want to assist with screening assessment tools, refer for early intervention for physical therapy, occupational therapy, speech and language therapy, assist with a behavioral modification program, promote positive reinforcement, increase social awareness, teach verbal communication, decrease unacceptable behaviors, set realistic goals, structure opportunities for small successes, and set clear rules. You may want to decrease environmental stimulation, assist with nutritional needs, introduce the child to new situations slowly, monitor for behavioral changes, encourage age-appropriate play, communicate at an age-appropriate level, so be brief and concrete, provide support to the family, and encourage support groups. SSRIs may be given to decrease aggression, and antipsychotics and melatonin can help with insomnia.